Hello, I'm Dr. Grahame Goode. I'm a Deputy Medical Director here at Blackpool Teaching Hospitals NHS Foundation Trust. I'm giving the COVID-19 update from the Trust on Wednesday the 17th of March. I'm pleased to say that in terms of the COVID numbers, our figures for this week are much better. We have 19 patients as inpatients, none in Clifton. Last week we had 24, so this is a reduction. We've had, sadly, 7 deaths, so which shows you that there's still a number of very sick patients in the Trust. Our vaccination numbers have gone up and we're working well, gone up from 18,537 to 19,000. In terms of COVID in the community, things seem to be improving, which is really good news. However, there's still a number of COVID positive patients in the community. This week's numbers are Blackpool 44 per 100,000, which is down from 77. Fylde is 59, down from 82. And Wyre has gone up slightly from 37 last week to 42 this week. In terms of critical care, we're now back to our normal 16 beds, which is a massive reduction on where we were some months ago. I think in many ways it's useful for us to take a moment in terms of this is a year on from where we started. We had our first case in March last year, and sadly we had our first death. From a staff perspective, we are incredibly grateful to all the staff that have worked so hard throughout this time, and there is a number of people that are very fatigued because of it. I know personally it's very difficult for the whole community. We've had 2 lockdowns and we're very grateful for the community to sticking to the rules, but we really have to be vigilant because, as you can see, there is still a significant number of COVID positive patients in the community, and we are still seeing daily positive patients. As a country, we've done spectacularly well with our vaccinations. We've done particularly well in the northwest and very well locally. And I can announce that people aged 50 and over are invited to have the vaccinations now, will be getting communication. And also people will be starting to be contacted about the second dose. It's really important to keep your appointment, and we will be going over Easter, so just a heads up for that particular time that you may be called for during Easter, and it's important to come when you're called. As you will have seen in the news recently, there are some issues and concerns for certain people with the AstraZeneca vaccine. I can assure people that we've had 11 million successful vaccines in the UK. There is no evidence of any safety issues. There is a pause in certain countries to look at data, but both the MHRA, which is our regulatory body in the UK, are happy that it's safe. We've certainly not seen any issues locally. So if you do get an AstraZeneca vaccine, you can be assured that not only will it work, but the risk of anything particularly bad happening to you in terms of clots are no greater than your risk of clots anyway. Finally, I would just again reiterate, as I have done in the past, that COVID isn't the only show in town. We are dealing with patients who do not have COVID, so the regular patients that we will always see with other acute conditions, heart problems, general surgery, etc. It's just a plea really to make sure that if you do get an appointment, please come. If you can't come, then you need to let us know, because we were during the first phase behind on a number of our diagnostic procedures such as scans. We are working really hard to catch up, and if patients don't come to their scans, then that just puts the list back. So a plea really to make sure that you do come. It's a COVID safe environment. We're all used to this now, so please attend for your particular scan or outpatient appointment. So it's just suffice me to say that there is still a little bit of COVID out there. It is really important to take all the measures that we do in terms of wearing face coverings, washing your hands and staying with social distancing. We are seeing light at the end of the tunnel. There is a clear roadmap. We're all very pleased to be going through that roadmap, getting vaccinated and getting back to normal. But it's really important that everyone sticks to the rules still until we're over that hump, and so we can all have a great summer.